Welcome to Friday's edition of COVID-19. Korea is standing close to the 800 level with regard to new infections amid a surge in the number of untraceable cases. And against this backdrop, research sheds fresh light on the psychological dangers of the pandemic. We have details later on. Here first is the broader pandemic coverage with our Eunsoo. So let's start with the latest here in Korea.
Well, Sunny, we are ending the work week on a concerning note with just 3 cases short of 800, 797 as of 12 a.m. And that's the highest figure in 106 days. Also, for the third straight day, infections have been in the 700s. And that has raised the domestic transmissions, the average in the past week, to above 640. And the total number of cases here in Korea stands at 117,450. Now, if we take a closer look now at our map, we see almost 300 cases in Gyeonggi-do province, a little over 200 in Seoul, and also here a surge down in Gyeongsangnam-do province with over 60 infections. And also the proportion of untraceable infections now stands at close to 30%. Now, to boost the nation's testing capacity, the Drug Ministry has conditionally approved 2 COVID-19 self-test kits this Friday, but it is a supplementary tool as of now, meaning if someone tests positive for the virus through the self-testing, they still have to require a PCR test to confirm that result. And on to other measures to contain the virus at high-risk facilities, the government says it will and is carrying out special inspections which are led personally on the ministerial level. Take a listen.
Through this system, ministers will visit the locations in person, inspect their compliance with prevention rules, and immediately address any shortcomings, as well as collect feedback from on the ground in regards to containment policies through gatherings with related bodies.
Let's also get a check on the vaccination updates. The country has surpassed 2 million vaccinations in total, and there's also been quite a number of people who received their second shot on Thursday.
I see. Meanwhile, in India, so I understand there's been another frightening surge in daily cases, and authorities there have identified yet another variant.
Right, Sunny, as if the double mutant was not enough of concern, now the country is facing another challenge with the so-called triple mutant variant that was first detected in West Bengal. Now, triple, as 3 COVID-19 strains combined to form this new variant, the B1618. Experts say this strain is more transmissible than others, but additional scientific research is needed. Now, fueled by the spread of double and triple mutants, India recorded the highest ever daily tally on Thursday with almost 315,000 cases, which is more than the US's record of over 307,000. Thousands of people are dying of the virus every day due to the lack of hospital beds and oxygen supply. And also, let's take a closer look at the numbers. India is at 16.2 million, and as of noon Korea time, the country has reported over 330,000 infections in a day, so it's likely to see another record. And also where cases are surging is Turkey and Germany, and Iran with over 20,000 infections has surpassed the total caseload of Mexico. We're also seeing an overall rise in infections with over 892 cases reported in the past 24 hours. And those are the updates I have for now, but I'll be back in a bit after the briefing. Sunny?
All right, so thank you for now then. Right, again, we turn to more domestic COVID-19 related coverage. And today here in the studio, I have Kim Sung-yeon with me. Welcome, Sung-yeon.
Good afternoon.
Right then, let's begin with the government's vaccination target for this month, Sung-yeon.
Right, Sunny, let me tell you about the first month plan by the government. The aim is to inoculate 3 million people by the end of this month and then 12 million people by the end of June. So that will mark the end of the first half of 2021. Now, Son Young-rae, a senior health official, noted that if we complete vaccinations for vulnerable groups by June, we will be able to significantly reduce the number of new infections and fatalities here in the country. To that effort, the government is opening more vaccination centers nationwide, and the country now operates a total of 204 locations, with almost 30 being newly added Thursday. Take a listen.
오늘부터 We will open another 29 vaccination centers starting today, for a total of 204 nationwide. The 29 new centers will be located in the cities of Busan, Daegu, Incheon, and also Gyeonggi-do Province. By the end of next month, we're planning to operate a total of 264 vaccination centers in the country.
As of 6 p.m. Thursday, more than 2 million people have received the first doses here in Korea, 55 days since the country began its national vaccination campaign. This comes as the country has been ramping up its inoculation drive by administering more shots and securing more supplies. Health authorities said the milestone was achieved thanks to the greater number of vaccination centers now open across the country, as I did just mention earlier.
Right, you did. Meanwhile, Seongyun, authorities are gathering data on Russia's vaccine.
Right, Sunny, this is a controversial issue indeed, as you can imagine, particularly over the concern of the safety of the Russian vaccine. But regardless, officials indicated on Thursday that the foreign ministry instructed its diplomatic missions in a dozen countries to gather more information on Russia's Sputnik V vaccine after receiving an official request from the drug ministry. The Ministry of Food and Drug Safety said earlier Thursday that it asked the foreign ministry to collect more information about Sputnik V, including any possible links to blood clotting. Foreign Ministry spokesperson Choi Young-sam said in a press briefing that the ministry has passed on instructions to some 12 diplomatic missions overseas and said they are closely monitoring all developments on the global vaccine front. The head of Korea's vaccination task force also talked about this on Thursday at the regular afternoon briefing.
We are in the process of collecting data on Sputnik V and also keeping a close eye on developments both at home and abroad.
This follows President Moon Jae-in's order on Wednesday to review the possibility of adopting the Sputnik V amid growing concerns over vaccine shortages here. Last week, the National Security Council also reportedly discussed introducing Russian vaccines to Korea during its standing committee meeting. Now, Sputnik V was the world's first registered COVID-19 vaccine, which came out August last year and is used in more than 60 countries around the world, mostly in South America, Africa, and the Middle East. The WHO said on Thursday that technical experts from the World Health Organization are due to start the next round of their review of the Sputnik V vaccine jointly with the European Medicines Agency starting on May 10th. In the meantime, Sputnik V has yet to submit a request for approval here to Korea's drug regulator as well.
I see. On an optimistic note, then, I also hear a homegrown Korean vaccine may be available late this year.
Right. The science minister was talking about this Thursday, that the country could develop a homegrown vaccine against COVID-19 by the end of this year as the country aims to further accelerate its inoculation campaign. Now, while Korea continues to secure COVID-19 vaccines from multiple global pharmaceutical companies, the country is currently developing vaccines through local pharmaceutical firms as well to prepare for a drawn-out fight against the pandemic. Minister of Science and ICT Choi Keehong said in a parliamentary session that it's very likely that a homegrown vaccine could be developed within this year, and the chances of that happening will be boosted with adequate support. Early this year, Choi said that homegrown vaccines were needed to quickly respond against new variants and lower the country's reliance on foreign vaccines. He said at the time that local pharmaceutical companies were developing COVID-19 vaccines and that phase 3 clinical trials could take place at the end of the year and could be available early next year.
All right then, Seongyun, as always, thank you for that coverage.
The pleasure is mine.
Right, it's time now for the regular briefing on the COVID-19 situation here in Korea for this Friday. Now, as I mentioned earlier, authorities are calling for strict adherence to prevention measures as infection numbers persist nationwide. So do seek to avoid venturing outdoors for social purposes that could raise your risk of infection. Also, while we wait for the briefing to start, here are a few words related to possible physical discomforts after COVID-19 vaccination. First, in general, medical experts say it is normal to feel uncomfortable for up to 48 hours post-inoculation. Now, this is reportedly an indication that the vaccine is working. But then again, the absence of such discomfort does not mean your vaccine is not doing its job. Doctors point out our immune systems are unique and thus respond in different ways. The briefing is about to start. We'll come back to you afterwards.
First of all, we have Mr. Lee Sang-won with the briefing today. Let us now begin our regular briefing on the COVID-19 situation here in South Korea for April 23rd, Friday. First of all, here is a status update on the COVID-19 vaccination. As of yesterday, we have over 2 million COVID-19 vaccination recipients. And as of yesterday midnight, we have more than 130,615 people being administered with their first dose, with the total now standing at 2,035,549. And the number of second dose recipients stands at a total of 79,151, up by 18,528 from the day before. And this is starting from the February 26th. And since then, we have been rolling out the vaccines. And also on the 5th of April, we have our total tally going over and surpassing 1 million. And we believe that we have marked this milestone much faster than we had expected. And in order to achieve our goal of 3 million by the end of April, we are also opening up new vaccination centers here in the country. And yesterday, we had 29 more centers open, and a total of 204 centers are up and running right now. And also, starting from the 29th, we also have in plan to open up 53 more additional centers to accelerate the speed of inoculation here in the country. And starting from next week, that is, we will also be providing the vaccines to all of the healthcare providers at hospitals and pharmacies, as well as those patients with chronic kidney disorders, as well as social essential workers. And our average daily infection rate stands at over 120,000 right now. And we believe that by next week, we would also increase this to about 150,000 going forward. And to this end, the government is currently exerting our full efforts to reach our goal of 3 million in this month, and also a total of 12 million by the end of June. And we believe that until the first half of this year, we will have our vaccines supplied by Pfizer and also AstraZeneca, and we have a total of 3.7 million, which has already arrived, and we also have more vaccines to also arrive here in the country. And also, starting from March, the Pfizer vaccines, a total of 7 million of them, have been arriving here in the country on a weekly basis. And also, we have in plan 5.5 million doses, which will be arriving on a weekly basis until the end of June. And as for the AstraZeneca vaccines, we believe that we have a total of about 857 million doses, which will be applied to Korea within the first half of this year. And we will also have additional vaccines supplied in the weekly basis as well. And we also have the 11 million doses that have been consigned under the COVAX facility, and we will also have more vaccines supplied under this plan in June. And we also have the AstraZeneca vaccines for about 340,000 doses, and we also will have more AstraZeneca vaccines arriving here in South Korea in the future as well. To this end, the government is also exerting our full efforts to carry out swift and safe vaccination rollouts as soon as possible. And here are our quarantine updates as well. After December, the COVID-19, especially considering the monthly ratio of critically ill patients as well as the fatality rate, we have seen a significant and meaningful decline. This means that we have been able to curb the spread of the virus to a large extent by containing the virus spread through the early detection of patients and also rolling out our inoculation starting from the high-risk groups. Moreover, at nursing hospitals and welfare centers, we are also able to contain the cluster infections, and we believe that we have also decreased the rate of fatalities stemming from these facilities. And after end of March, when we had the peak of the third wave, the ratio of critically ill patients and the fatality rate are also on a steady decline. And in December last month, we have had 2% of the critically ill patients, and temporarily this has been decreased to about 1.7% in March. And also, we believe the fatality rate has dropped to about 0.49% in March as well. And also, in the age group of those over the age of 70, we have seen a significant decline, and also a significant decline is also witnessed among the group age of those over the age of 60. And looking at the fatalities, we had no cases of the fatality after being hospitalized, and since March we are on a steady decline as for the number of fatalities. And here are the updates on our therapeutics administration. The Vaccination, which is the remdesivir here in Korea, we have also administered the drug to more than 6,100 people here in Korea, and the regular treatment have been administered to more than 1,900 patients here in Korea as of now as well. And as for the blood plasma treatment, that is, we have been administering this treatment to about 43 patients here in South Korea as well. And our daily tally is hovering over 700 for 2 straight days, and we are also seeing looming signs of a possible large spread outbreak here in the country across the country as well. And to this end, it is very important that we contain the further virus by protecting ourselves, and it is also very important that you wear your face mask at indoor spaces, and also refrain from having non-essential outings and meetings, and also keep abiding by the gathering ban of more than 5 people. And if you have any clinical symptoms of COVID-19, you shall not go to school or work, but rather you should visit a screening clinic to get tested as soon as possible. You should never go to a public use facility when you have similar symptoms. Please note that COVID-19 is also can affect anyone, and to this end, the vaccination is very crucial to protect yourself, your family members, and your neighbors as well. And we are seeing the effectiveness of the vaccines, and if it is your turn to receive the vaccines, we ask you to also receive them as well according to the schedule. And please note that you shall receive the shots when you have great health conditions and have no fever and other symptoms. Right now, on a global level, we are seeing an increase in the COVID-19 tally, and many countries across the world are struggling to fight against the COVID-19 pandemic. And the Korea is also at a similar situation. It is, of course, a challenging situation that we face right now. However, nevertheless, we will also exert our full efforts to contain the virus to a large extent.
Right, there was Lee Sang-won with Friday's afternoon briefing. So what did he have to say?
Let's start with some updates on the vaccination process. He mentioned that we are having around 120,000 to 130,000 inoculations a day, and by next week we could even reach around 150,000 daily vaccinations, with more groups of people being subject to COVID-19 vaccinations. And another opening of 53 new vaccination centers is expected from the 29th this month. Also, he mentioned that the fatality rate has been going down, and also the number of the proportion of people in severe or critical condition has been going down ever since the vaccination program kicked off, and we have expanded preliminary testing and also the expansion of hospital beds designated for COVID-19 patients. Last but not least, the official also mentioned that basic prevention measures should be abided by, especially with currently the country facing risks of a wider spread of the virus.
I see. All right, Soa, thank you for that.
Thank you.
Right, back here in Korea, well, staying in Korea, that is, community health centers are deploying mobile vaccination units to places where people cannot easily access inoculation sites. To take a look.
Nearly 2 months into Korea's public vaccination campaign, community health centers across the country are buzzing with activity as medical workers race to inoculate as many people as quickly as they can. Vaccines are being distributed at 3 different types of locations in Korea, with the first being regional vaccination centers capable of serving large communities. The second are existing medical facilities, such as general hospitals, long-term care centers, and community health centers. Lastly, residents and staff at nursing homes are inoculated by a traveling team of medical professionals.
질병관리청 지침에 의해서 감염 확산 위험이 높고 감염에 걸렸을 때 치사율이 높은 요양시설 대상으로 접종을 진행하고 있습니다. 의사 1명, 접종 간호사 1명, 모니터링 간호사 1명, 행정인력 2명, 그리고 구급차, 그리고 스타렉스가 같이 동행해가지고 접종을 하고 있고요.
The team handles a long list of medical supplies and equipment, but the vaccines themselves are the most precious cargo of them all.
왜 앞에 따로 실으세요?
백신 온도를 2도에서 8도를 확인하기 위해서 15분마다 제가 온도 체크를 하고 있거든요. 그래서 여기에다가 싣고 가고 있어요.
The team has arrived at this nursing home to vaccinate its elderly residents, many of whom struggle with mobility issues. Once the workers are ready and their medical supplies are sorted out, this nursing home is transformed into a makeshift vaccination center.
연령이 고연령이다 보니까 챙겨야 될 게 좀 많았거든요. 그래서 이상 반응이 나타났을 때 수액요법이나 약물 치료, 산소요법이 가능할 수 있도록 세팅을 해놨고요. 그리고 응급 상황에 대처할 수 있는 제세동기 가지고 있고요. 가벼운 증상을 체크할 수 있는 혈압계 가지고 있습니다.
Once preparations are complete, the vaccinations can begin, after the residents go through a simple medical checklist.
어르신 예전에 주사 맞고 나서 알레르기 났거나 붓거나 그런 거 없으셨어요? 없으셨고요.
아무래도 고령이신 분이 많으시다 보니까는 저희가 좀 목소리를 또박또박 해가지고 어르신분들한테 좀 정보를 잘 전달하는 게 중요하다고 생각하고요. 그리고 옆에 계신 보호사분들께도 도움 많이 받고 있습니다.
The medical staff must stay alert, given the advanced age of the residents here, many of whom also have underlying health conditions.
예. 일반적으로 요양원에 계신 어르신들은 오래 누워 계시고 활동성도 떨어지기 때문에 그에 따른 활력 징후가 좀 감소되어 있습니다. 때로는 우리가 알아내기 힘든 증상이 감춰져 있는 경우가 있기 때문에 저희가 잘 찾아내서 거기에 신경을 써서 접종을 하고 접종을 한 다음에 세밀하게 모니터링할 필요가 있습니다.
These traveling teams of vaccination workers have played a vital role in protecting the health of Korea's most vulnerable citizens.
의사분들이 전 와주시고 했는데 어떠세요?
마음이 편안하고 좋네요.
거동이 불편하신 어르신들이 직접 가서 접종 안 하시고 오셔서 접종해 주시니 너무 좋고 의료진 분들이 관찰까지 해주시고 대기까지 해주시니까 든든한 것 같아요.
1 month into Korea's vaccination campaign, the number of cases occurring at nursing homes has fell around 8%. Thanks to the care and dedication shown by the traveling medical staff, 10 residents at this nursing home got their vaccines today as scheduled. But there's little time to rest because the team is needed elsewhere, where more people are awaiting their shots.
백신 접종이 빨리 이루어져서 코로나 잘 극복했으면 좋겠습니다. 저희 방문 접종 팀도 더 열심히 노력하겠습니다.
Vaccination efforts on the local level are making sure that no one is left behind in our journey towards herd immunity.
이러한 신체적 부분뿐만 아니라 정신과적 후유증으로는 우울감 그리고 외상 후 스트레스 장애가 주로 나타났습니다.
The world is well into its second year of the pandemic, and in our studio session today, we revisit the psychological repercussions of COVID-19. Now, here in the studio with me, I have Professor Keehong from Korea University. Welcome back, Professor Che.
Thank you very much for having me.
And in the spirit of social distancing, I have Professor Eunsoo at Cha University with us via Skype. It's lovely to see you again, Professor Won.
Hello, thank you for having me.
Also joining our talk today virtually is Professor Jimena Goldberg at the Barcelona Institute for Global Health. Pleasure to have you with us, Professor Goldberg. Right, Professor Won, we'll begin with you then. Let's start with an overview of the psychological impact of the pandemic on the general public, Professor Won.
Well, it's been a tough year for everyone. The rate of people suffering from depression, anxiety, substance use problems has greatly increased. A lot of my patients who were already receiving treatment before the pandemic were showing worsening of the previous symptoms, whether it was emotional problems, sleep problems, obsessive compulsive disorder symptoms, substance use problems, and suicidal ideations. And I also had new patients coming in as well, who had never received treatment before, but were extremely stressed by this pandemic situation and had newly developed symptoms. And specialists are concerned not only about the current mental state of the general public, but also about the potential long-term impact of COVID-19 on our mental health. Studies on previous pandemics and national emergencies, such as the SARS, Hurricane Katrina, and the earthquake in Japan, have reported adverse mental health effects, such as psychological distress, PTSD, and suicide to continue years after the disaster situation itself. So in my opinion, we should expect mental health needs to continue long after this infectious outbreak resolves.
Right. Meanwhile, Professor Che, you've been actively researching the mental toll of COVID-19 on the Korean public. Could you tell us a bit about your study and its findings?
Sure. Our group has conducted a longitudinal study among thousands Korean representative samples. We have collected data every other month from last year, May last year, and we tracked the same individuals over time, over the past 11 months. The level of mental health, such as depressive and anxiety symptoms, and suicide risk has been severely affected by COVID-19, as mentioned by Dr. Won. And those levels has been fluctuated over time. And specifically, about 30 to 40% of individuals reported mild to moderate levels of depression and anxiety symptoms, and about 20% of individuals reported some levels of suicidal risks. And those symptoms actually exacerbated when we had the prevention stage of 2.5, which happened last year, September and December. Now we are in the prevention stage of 2.0, so the levels of depression and anxiety was somewhat reduced. However, the most concerning part is that even though we had lower levels of anxiety and depressive symptoms at this moment, the suicidal risk has been increasing. And before, actually, men had the much higher levels of suicide ideations and risks than women, but now both men and women's suicide risks are increasing.
I see. And Professor Che, how does such psychological status look to affect efforts to contain COVID-19, do you think?
There should be several reasons and maybe several factors. I can think about maybe the uncertainty and the kind of hopelessness about financial hardship and future job and education about their children, etc. And also second one would be the social isolation, and which causes a lot of lack of resources and lack of support. And clients I have in my mental health clinic reported that they do not know how to care about their emotional distress within this very challenging time and their desire. So sometimes they are too much exposed to the SNS, which is very much biased information. So without the real interpersonal relationship, they feel kind of left over and feeling behind.
I see. Professor Goldberg, you've also been studying the psychological challenges of navigating through this global pandemic, and you warn of a host of mental health issues well after the pandemic. What is your warning based on?
Yes, we have done these reports where we go over 4 different sources of distress that are associated with mental health disorders, and that we are seeing in our population in Spain, but also in other countries, as my colleagues in Korea have just mentioned. So at the first level, what we see is that along with the epidemic, our whole relationship with the environment has changed. So we are more afraid to go outside, and we are more at home, and because we have to stay home. And so this has changed our whole experience of the environment. And most of us live in big cities, where we don't have access to green spaces or blue spaces that we know are relevant for our mental health. So this distancing from the nature and the environment it's a key factor for mental health. But we also see another topic that are associated with mental health problems. There are changes in our relationships. So during confinement, we had to stay at home. Here in Spain, we have 2 months of staying at home very strictly, and this raised tension within the families, raised the levels of domestic violence, and this caused a lot of trouble and problems in the family and the households. And we also see some mental health problems associated to COVID itself. So mental health symptoms, as you have already mentioned, are present among people who have had COVID and in the long term presents depression and anxiety, and this also raises the prevalence of mental health disorders in the population. And of course, well, finally, we have to mention all the restrictions in access, the disruption in access to healthcare, which has caused a high distress and a worsening of the problems that were before the start of the pandemic, along with economic and financial strain. And all of these factors taken together, of course, they won't be solved with the vaccine, but rather once we have reached immunity at the herd level, then we still expect to have a very high increase of prevalence in mental health disorders.
I see. Professor Won, quite a number of COVID-19 survivors are known to suffer from various long-term physical conditions. Now, having said that, what can you tell us about the psychological conditions of long COVID?
Well, a recent observational study published in The Lancet Psychiatry reported 1 in 3 COVID-19 survivors received a psychiatric or neurologic diagnosis within 6 months of infection. The most common diagnoses after COVID-19 were anxiety disorders, mood disorders, substance misuse disorders, and insomnia. Neurological diagnoses such as stroke and dementia were more rare, but not uncommon in those who had been seriously ill. And these results suggest COVID-19 affects our mental health, not only through the extreme stress of the situation, but actually has a biological influence on our brain. And some of the symptoms that were reported in the study were already anticipated, such as anxiety disorders and stroke. But other symptoms are less so, such as dementia and psychosis. And what was very new for this study was the comparisons with all respiratory viruses or influenza, which suggests that these increases in psychiatric symptoms and diagnoses are specifically related to COVID-19 and not a general impact of viral infection. So overall, the worse the illness due to COVID, the greater were the psychiatric and neurological outcomes.
Right. And Professor Goldberg, keeping in mind what Professor Won has just said, what is known thus far about the reasons behind perhaps the more severe mental conditions of long COVID?
Yes, as you know, there's a lot of research going on right now, so we have new information pretty much every day. But we do have new research on brain studies that are based on post-mortem brain, people who had COVID and passed. And so they, what they have found is some evidence on let's say, on defense cells, like immune defense cells that are present at the level of the brain, that are indicators that the body has responded at the level of the brain in terms to defend itself from the pathogen. But then the problem with that is that these defense cells, what they do is that they attack neurons. So the consequence is that there is a loss of neurons in different areas of the brain. And what we see is that the specific locus of this loss on the level of the hippocampus, which is associated with mood and memory and may explain the symptoms of depression and anxiety, and also at the level of brainstem, which is associated with the loss of consciousness and could explain the symptoms of dementia and psychosis. But as I said, this is moving very fast, and we probably have new information in very few days.
Right, because it's still in ongoing research.
Yes.
Professor Che, I believe you've said earlier, this is in the early days of the pandemic, you claimed that women in their 20s were much more vulnerable to the psychological impact of the pandemic. Is this still the case? And if it is, could you explain this reality for us?
Unfortunately, we see the similar pattern now, but both men and women in their 20s and 30s had much higher mental health issues than other age groups. I think young people in their 20s are being isolated without real interpersonal relationships, and they need to prepare for the future job, and they need to, prepare for their life, but they need more information from others, and also they need some more, empathy, understanding by others. But now they have much higher levels of uncertainty with limited information and limited social support. So that's why in their age, those kind of factors may affect the higher levels of depression and maybe the anxiety, and again, too much exposure to the SNS. And without real social relationship and interpersonal relationship might be one of the reasons for having higher levels of depression and anxiety.
Right. Professor Goldberg, research shows people with schizophrenia face immense risk of dying from COVID-19. Could you explain this for us?
This is a very interesting finding. Because at the beginning we thought that because there was a higher risk of infection among people with mental health disorders, and so but it was explained at the level of the behavior. So what we thought was that maybe people with mental health problems, they would have difficulties on judging the risk and perceiving their own risk of infection, and would put themselves at an increased risk. It would explain that they got more commonly infected, but it doesn't really explain why the infection acts more severely in their bodies. So what is now being researched is a little bit what I referred before, pro-inflammatory processes that are common to infection by COVID and some mental health problems that can make people more vulnerable to the infection, to a more severe form of the infection. And there's also some studies on the genetics levels that are suggesting some genotypic variants are common to both infection by COVID and mental health problems, severe like schizophrenia. And this could indicate some kind of susceptibility to a more severe form of the infection.
I see. And staying with that, Professor Wan, findings by authorities here last June show some 44% of those who had passed away from COVID-19 had pre-existing mental conditions. Now, how do you respond to belief that their fragile mental state may have aggravated matters?
Well, yes, there may be that possibility, but I'll have to say it's a combination of factors why the fatality rate was high in those with severe mental disorders. Because such individuals are generally known to have a higher risk of somatic comorbidity than the rest of the population. So when these patients get acutely physically ill, they're going to be even sicker. But also, as you've mentioned, the increased risk for mortality may be associated with the mental disorder itself as well, or its pharmacological treatment. Because patients with severe mental disorders may have difficulties in initially expressing symptoms. So initiation of treatment may have been delayed, or difficulties adhering to preventive and treatment measures due to the decline in cognitive function. And also patients are known to be more vulnerable to stress, and severely acute or prolonged stress negatively influences our immune system. Also, a lot of patients smoke and have substance use disorders. So this increases the risk of pneumonia and cardiovascular diseases, which can influence the treatment course. And medical conditions associated with the pharmacological treatment of the psychiatric illness, that can induce medication-associated neutropenia or heart problems and obesity. And also, immobilization is common in patients due to lack of exercise and restraints in treatments with antipsychotics. That may constitute further risk factors for venous thromboembolism and etc. So even if the severe mental disorder per se is not involved in the pathophysiology of COVID-19 infections or its clinical course, such patients should be recognized as a group to be at risk of serious illness from COVID-19 infection.
I see. Then, Professor Won, what measures do you propose to tackle a possible surge in psychological hardships post-pandemic?
Well, the strengthening and broadening of national policies related to mental health, I definitely think are needed. For a long time, psychiatric illnesses were not the main focus of policymakers for various reasons. But now it's evident that more resources should be invested. And so improvements in community mental health services, mental health facilities, and medical insurance policies should be made so that a broader population can receive quality mental health care. And also actions, events, and campaigns involving national broadcasting and social network services that improve awareness and decrease the stigma on mental health issues and its treatment should be widely and actively carried out.
Right. And Professor Goldberg, for your part, what action plan do you recommend to address the psychological impact of COVID-19?
Yes, I agree with what has been said. We need to implement higher quality mental health services, and from the very beginning of the pandemic, this should have been taken care of. This is not something that's secondary to the pandemic, but it's something that has been there for the very beginning. And we believe that mental health services need to be taken as essential part of the response to the pandemic. We also think that there are some preventive measures that can be taken. For example, high quality urban environments that can help cope with situations such as isolation, for example, could be a very good reason to have healthier cities around us. And also we are very much in line with what has been said on community basis, basic services. So people don't need to go to big healthcare hospital centers because they might be afraid of going there, or maybe a stigma associated with going to see a psychiatrist. Maybe some previous interventions, early detection of the first symptoms could be a very good way to prevent a more severe form of mental health disorders and a better outcome in the end.
Right. Professor Che, generally speaking, what are some of the ways of ensuring our mental well-being amid this prolonged pandemic?
First of all, from the behavioral psychologist perspective, we recommend people monitor their daily routines. So we need to take care of the daily routines like sleep, eating, physical activities, and social relations. So if with their efforts to tackle on those kind of things, and if have higher levels of depression and anxiety, I think professional mental health services and professional psychological services should be provided. So, and the government should provide balanced information for tailored individual, for people recovered from the COVID-19, they should be provided information about how many people are in quarantine and how they perceive it and how to react to other persons and what would happen after the quarantine, how to get back to the job or adjust to the school or something like that. Also, the company's institute should provide guidelines and environmental support for people who return from the quarantine to prevent discrimination and facilitate supportive environment. And also, I should say that there are free psychological online services provided by the Korean Psychological Association, Korean Society for Traumatic Stress Study, and the Ministry of Health and Welfare. So those information should be actively used by the public.
Right. All right, Professor Che, thank you very much for your insights. And Professor Won, thank you very much for your words. And Professor Goldberg over in Spain, thank you for your time and your thoughts.
Thank you very much.
Right. The pandemic is affecting us both physically and psychologically. Having said that, do seek to reach out to loved ones, virtually that is, while abiding by COVID-19 prevention measures. Thank you for watching.